With the onslaught of bad news from hurricanes, Afghanistan, and COVID-19, there's another recovery effort that's fallen off the radar for far too many, even as the situation gets worse. Nearly a month after an earthquake killed more than 2,000 people in Haiti, destroyed thousands of homes and businesses, the Haitian government is warning of a spike in kidnappings and other crimes due to gang activity. Sadly, it's a scene far too reminiscent of 2010, when a devastating earthquake hit, followed by a cholera outbreak that was later traced to UN peacekeeping forces. Now, once again, Haiti finds itself trying to rebuild from multiple crises. Joining me to discuss is Dr. Louise Ivers. She's Executive Director of the MGH Center for Global Health. She lived in Haiti for 10 years and helped manage responses to that 2010 earthquake and cholera outbreak, and she just returned from another trip to the country. Dr. Ivers, thank you so much for joining me.
Thanks for having me.
Could you describe what you saw when you were there recently?
Oh, it was really devastating, really impactful. Small villages, small towns where homes have been completely destroyed, very significant damage to infrastructure, roads and bridges, really physically damaged by the earthquake itself, and a lot of people just really needing help, medical help, and help for their livelihoods as well.
And my understanding is even things like clean water, some basics, are unavailable to thousands and thousands of people. Is that correct?
Yeah, that's correct. I mean, I think it's important to know and to remember this part of Haiti, the southern part of Haiti, is already quite rural. The infrastructure, even on a good day, the roads are quite tricky. Access to water, food security is already a challenge. And just 5 years ago, actually, Hurricane Matthew really devastated this whole area with hundreds of thousands of homes flattened then and livelihoods and farms wiped away. So people there were still really recovering their livelihood from that. So to add on top of that crisis is really problematic for the people.
You know, with the assassination of the president of Haiti, what I've read from afar is how much even more influence gangs have had in Haiti. We read that Doctors Without Borders had to close their hospital in Mortisson, I think, in Port-au-Prince over the summer because of gang activity. How much harder does that make the work of dedicated people like you and so many other doctors and support people?
Yeah, the security situation has made things really challenging. And actually, even before the assassination of the president, there was serious gang activity and thousands of people displaced from their homes in the area where they just couldn't live because of the violence that's going on. And it certainly hampered the humanitarian response to the earthquake, not just outsiders like myself, but also local doctors and nurses and teams trying to bring food supplies, and others have really had a hard time because of the violence. There had been a truce, so to speak, and a ability for humanitarian convoys to pass for a couple of weeks. But from all that I'm hearing now, things are beginning to deteriorate again, making that very difficult.
You know, I've had several Haitian American leaders from Boston on the show, and I've asked them, how does your family and your friends back in Haiti, how do they endure this series of nightmares, one after another? And they all talk about the resilience, which I guess for someone like me who hasn't been there is hard to understand. How would you answer that question? How do they survive when, just as you're hoping to get over one catastrophe, another befalls you?
Yeah, I mean, I think the kind of foreign gaze on Haiti is often to use the word resilient, but I do think one question is like, how much can a people be asked to endure by either their own government or by external governments that really interfere? I mean, people want to live, they have children to feed, they're trying to get their children to school, they have livelihoods, they want to survive. So I think the endurance to survive is a very human one, but I do worry that we just continue to see this difficulty and this kind of oppression of people through structural deficiencies.
You know, I know you know, and I have encountered reams of people who have wanted to help in some fashion, but lots of those people, we have Laura Sullivan from National Public Radio on the radio with us tomorrow, who with ProPublica, you know, a handful of years ago, talked about the $500 million that Red Cross raised after 2010 and what happened and didn't happen with it. If people are to avoid major organizations like Red Cross. Is the alternative to seek out local organizations from afar and give direct donations to them? Is that the desired path?
Yeah, I think a really important kind of terminology in the international development is about localization of aid. And I think Haiti is a prime example where there are hundreds of local organizations, very, very strong civil society, people already helping each other from the first moments of the earthquake in this circumstance, partly because other people couldn't even physically get there. But it's really important when you're being charitable. And I think we should continue to help in Haiti. It's very important not to look away. It's important to seek out and see what organizations have been there for a long time, who's the Haitian, where are the Haitians leading? How can you make sure that it's not just organizations that are showing up kind of as part of the crisis caravan, so to speak, to respond? I mean, there's important logistics work in an earthquake, for example, that many smaller organizations can't do. You have to lift heavy material, etc. So there is some need for logistical support, but generally speaking, for the long term, it's important to find organizations that have been there for a long time, that are led by Haitians, that understand the community, and that are going to be there to make sure that money is well spent. With our own federal assistance too, I think we have a role as citizens here to just call on our leaders to make sure that the money is being also put to good use.
I echo those things, and I can't tell you how much I admire you and your work. Dr. Ivers, thank you for sharing the story. Really appreciate it.
Thanks very much for talking about Haiti.